Hello, welcome. This is Man and Markets and I'm Charles Boyd, your host. Now, one of the most important decisions, crucial decisions that one can make today is seeing how they can control the COVID-19 infection in a household, especially. This is because of the huge costs that are involved in treating a single case of COVID-19. So today, we pick the minds of some of the senior people in the Ministry of Health to try and find out how best a household can control and prevent this disease, but also put into context the economics of COVID-19.
As a country, we are currently in the fourth stage of the COVID-19 prevention. And the COVID-19 prevention, such kind of stage, means that we have a lot of community transmission. It indicates that we cannot be able to know how many people have been in contact with somebody who has been found to be positive. So that literally means that we have many people who are turning out to be positive, many people who need specialized treatment, and we also have many people who are still undergoing home-based care. Actually, almost 90% of people who are found to be positive in their homes, they are being taken care of by their families. Now, if you're looking at the cost and the implication to an individual, and the cost to an implication, you're looking at costs and what it implies to a family, you're looking at cost and what it means to the country. It's quite comprehensive in nature. You need to look at a number of things, even beyond the actual service that you may pay for, or a particular drug that you need to buy from a drugstore, from a pharmacy, or from a medical facility. But you look at the cost implication in terms of the mind, in terms of the psychosocial support, in terms of, in other words, there's quite a lot in terms of socioeconomic that we need to look at and address as a country. And even the implication of COVID-19 to individuals and the country, even when it is completely out of the country. There are things that we shall definitely cover after some years. It's very clear that some people have lost jobs, some people's businesses have closed, some people have lost years, those who went to the education institutions, people have not been able to graduate on time, people are going to be able to repeat some classes for years. So the cost to parents, the cost to young people is quite big. And even beyond what technically we may be grappling with as the sector, now we need to have a lot of discussions on what are some of the key concerns we need to look out for currently. Number one, we require to have a lot of family-led discussions. The current phase we are into takes away 90% of the responsibility from government, from health scientists like us, to individuals now. And so the 90% responsibility on the response was on the technical teams last year. It has now transferred to individuals and communities. So for us to be able to get back to our normalcy, people or individuals or communities need to understand this fully, that the health workforce, the health sector, the health scientists, and many more other support staff are providing 10% in terms of providing technical guidance, in terms of providing care, in terms of... But if you look at what somebody requires for them to be able to recover all through, you may spend like, say, 14 days in the hospital. But the process of recovering out of hospital, the process of being able to engage with people within your home, for them to be able to mentally understand that things are now back to normal, the psychological torture, it's very difficult to cost it. As a public health expert, there are quite a number of things I would advise people to look out for. Number one, there are those health choices we need to make. Health choices in terms of our behaviors, the way we eat, the way we drink, the way we socialize with the people. And of course, because literally what people forget is that lack of money impacts on your health. Mentally, it works on your health. And failure to work on your spending habits, or the decisions you take in spending money, literally, translates into whether you'll have a happier or healthy life or not. And because also from the public health point of view, we are uncertain of the situation in the country. We are currently in our second wave. You never know what may happen in December. We have seen different countries go through different waves, including the developed countries. So people should know that some companies will definitely collapse. There's no doubt about that. So now people need to sit on paper and resort to thinking about how best can we go by the basics. In the way we eat, the way we dress, the way we socialize, the places we go to, and how much we spend. It's a concern to us because we know that at the end of the day, that will definitely translate into psychologically or mentally how people think about how to live. We have seen people killing themselves because they are not sure of tomorrow.
Well, we're still looking at the impact of COVID-19 on Uganda's economy, how deep it will go. And in this segment, we're picking the minds of global economists on what they think of Uganda's economy, especially post-COVID-19. As COVID-19 continues to batter global economies, including that of Uganda, the conversation among economists is now shifting to how Uganda can manage the recovery better, dealing with the impact of the crisis and the inherent economic challenges that had persisted even before the crisis.
We can build back better. So building back better, how do we bring extension in a different mold? By embedding not just the climate smart agricultural practices. Can we deliver it in such a manner that we are actually embedding practices that are making our smallholder farmer, our agribusinesses more resilient? Can we do more of it actually? You know, at the moment, indeed, there's a budget for extension. There's a bit that's being done, but it is an ongoing process that even informs quality management. So if you see Kenya or the region saying no to our maize, all of a sudden, a big crisis for people who have invested heavily in a lot of maize. But it goes right down to the farm. And practices that should have been managed there, controlled there, are missing in action.
The reason why emphasis is placed on supporting agriculture is because of its ability to expand amidst this crisis, with subsectors such as coffee reporting unprecedented export numbers in the COVID crisis year of 2020. This assertion is consistent with what the Minister of Finance says it has already witnessed growth and expansion of some sectors and subsectors of the economy.
Manufacturing actually did very well, and we had new things that we are producing in this country that we had not produced before, especially sanitizers and other PPEs, which we took on. We had the steel subsector also doing very well.
To the central bank, some of these green shoots amidst a crisis, especially for the manufacturing sector, are partly a result of timely and responsive policies, like the current monetary policy stance taken by the bank.
So the fact that Uganda had a strong macro foundation, were able to ease monetary policy by doing CBR. I know there are some people who say the pass-through from CBR to lending interest rate has really been, very small. That's a fair comment. But also, that is at a macro level. But particular sectors benefited from that easing. For example, if you I look at numbers every day. If I look at, say, interest rate to particular sectors like, say, manufacturing, averaged around, now it is averaging around 15%. in between between January and April. 15% is down compared to where we were around 18% for the same sector.
But even as economists look at the brighter side of the crisis, the economy broadly remains in the woods, with critical performance indicators like the country's debt touching worrying levels.
Because when you look at our growth trajectory before, we had actually been growing at very high rates, 6.8. We had expected to grow by about 6.5. So the things that we are doing, the policies, I think we are right for growth. And then comes in the COVID pandemic, there is a lockdown, and the lockdown had a lot of impact. Of course, going forward, we thought that we are recovering, but we pray that the second wave, which has just come now, does not really hurt us a lot.
Today, uncertainty still remains about how much impact COVID-19 will have on Uganda's economy. But the crisis, according to some experts, also offers a good reflection moment for planners to reconfigure the economy for better performance moving forward. Well, it's time now to take a very short commercial break. Man and Markets continues after this break.